Welcome back to Rubbin Minds. Now, for the longest time, issues around women's health has been underreported. How did you see programs on TV, on radio, online, talking about issues that affect women directly, women's health, whether it's endometriosis or it's cervical cancer, it's even as little or as small as you would think. People's understanding around how a woman's body functions, from menstrual period to menopause to pregnancy to delivery, to how hormones play such a huge role in a woman's body. The issues of women's health continues to remain underreported, but Bella Naija has always been a strong advocate for women's health, and they currently have a campaign which is stopping HPV. HPV stands for human papilloma virus, and the aim is to get as many people aware about the impact HPV has and how it can lead to cervical cancer. But if there's knowledge, then prevention can happen, and not just treatment and management. To discuss this issue, I have with me a doctor, a social impact strategist, someone who has used storytelling to communicate very tough, hard to understand issues in a very entertaining manner. She brings health and entertainment together, and you can guess, she is Dr. Kelechi Okoro, health-tainer.
Drum rolls.
Welcome to Rubbin Minds.
Thank you so much for having me. You look beautiful.
Oh, thank you. And you look stunning too.
Thank you very much.
When we think about women's health, why do you think there's little money that goes to research, first of all? Then we can now see the media and that focus. Growing up in the 90s, we saw how much HIV and AIDS were in our faces. But how can we say the same thing for cervical cancer, or for endometriosis, or even menstrual periods?
So if you ask me, you're asking me directly, right? I'll say that there aren't enough women sitting at tables where these decisions are made. And if we're not speaking for ourselves, then we don't have enough people speaking for us, okay? So there's been a lot of research going into other areas, but women's health, especially sexual and reproductive health, not a lot of research is going into that area, because first of all, even as a doctor, the things that I learned about, the things that I know right now about menopause, about menstrual hygiene, about menstruation, were my personal experiences and experiences from community members. So there hasn't been a lot of talk. Our voices haven't been loud enough when it comes to, women's health, when it comes to issues like this. There's stigmatization, there is just, people just not talking about it anymore. But these days, we're here, Bella Naija's brought us here to talk about the Stop HPV for Her, and it's a campaign that is ongoing. So more talk, more awareness, more effort put on policy making to back these things up, to create interventions that suit the woman. And of course, things are going to get better going from here.
So hashtag Stop HPV for Her. First of all, human papilloma virus. What's that for the layperson out there watching? And why is it so important for Bella Naija to support this campaign? Why now? Why human papilloma virus? And what's its relation to cervical cancer?
Okay, so this conversation is very important because HPV causes cervical cancer, and cervical cancer is like the second leading cause of cancer deaths amongst women. Okay, and about 12,000 women will be diagnosed in a year. Guess how many of those that number dies? 8,000. The number is not numbering at all. Okay, and this HPV. It is something that can be preventable. Almost 100% preventable with the HPV vaccine. So why are women dying from something that they can prevent with just one shot? That's why this conversation is very important. We can't have our Nigerian women, African women dying because of something that could have been prevented before exposure to the HPV. Okay, with early testing, with early detection. So why are women dying from it? And that's why this conversation is very important, because we can actually do something about it. And then these numbers need to drop drastically, because women are a very important part of building this nation. Okay, right or right?
Yeah,
exactly.
Right.
So if we do not take our women's health seriously, then the nation is going to decline economically, health-wise. So it is very important that we're having this conversation at this time. This conversation, this intervention by this Stop HPV for Her, this should have been yesterday. This should have been 20 years ago. This should have been 10 years ago. But we're having it now, and it is very important that we're having this discussion.
It's interesting because there's so much more information around, say, breast cancer, and then you're saying cervical cancer is the second cancer that kills women the most, and the chances of recovery are so slim, the numbers are so low. What is this government doing to address this issue, to make prevention the mantra that a parent, I have a daughter, that I know that once my daughter turns this age, she needs to take that HPV vaccine?
Okay, so in 2023, the government rolled out, vaccines for girls between the ages of 9 to 14. And why 9 to 14? Because we want to meet these girls, we want to, get this intervention in before they are exposed to the HPV virus that causes cervical cancer. Okay, so girls between the ages of 9 to 14, from 2023, have been getting free vaccination from primary healthcare centers around them. Okay, and of course, the vaccine is not just for girls. It is for women also, who have, even women above the ages of 20, but this time around they can, fuse it with the HPV testing, and also pap smear and HPV DNA testing. Okay, but the government has done this so that at that stage the immunity of the girls is still, strong enough to get that protection. You know how immunization works, to get that protection, so that when you eventually get exposed to this this virus, then it will ward it off. The problem with cervical cancer or HPV infection is that when you get that infection, 1 to 2 years, your body can ward it off, right? However, if you get the high strain, which is the HPV 16 and 18, it can stay in your body for 10 years, 15 years, 20 years without any symptoms at all. And then when you get a diagnosis of cervical cancer, from then it could be death, okay? Because there are no symptoms. However, when the symptoms start, after 10, 15, 20 years, you can get symptoms like painful periods, bleeding in between periods, having bloody vaginal discharge. But at that time, it's already far gone, okay? And that's why it's very important that the government has in fact, they have even added it into the national, immunization scheme. 9 to 14 girls should get this vaccine. And I like the fact that you talked about you being the mother and being here and having this information, because some of these girls are not going to watch this, okay? So it is left for the women listening to this, watching this, to make sure that these girls are taken to the primary healthcare centers to get it. You can also get it in private facilities. However, the price,
at a cost.
Yeah, exactly.
Now, for older women who are probably watching this and they never took the vaccine between 9 and 14, what hope is there for them? What should they be doing? Should they run now to their doctor and get tested? And if they do find out that the human papilloma virus is in them, what's the next line of treatment or line of action? Okay,
so for those who haven't gotten the vaccine, they still have hope. Okay, but first of all, they need to go get a pap smear done. It is a test where the doctor looks into your vagina, gets a sample, gets all the way to the cervix. The cervix is the neck of the womb. Looks into there and gets a sample of the cells in your cervix to see if they are pre-cancerous changes, and if they aren't, you can get the vaccine. Okay, so from 21 to 30 years old, you can get your pap smear done, and if it's negative, every 3 years. And then also you can get the pap smear done and then also add the HPV DNA test or the VIA test. So there's hope for these women. Remember that there are different strains of HPV, right? The high strain is the 16 and the 18. You might have been exposed to other strains. However, you have not been exposed to 16 and 18. So you can still take the vaccine later, even after exposure, to any other HPV strain that you have gotten. Because remember, HPV is very, very common. Okay.
How are people exposed to it?
It's just by intimate skin-to-skin contact. Okay, it's not a moral issue. It's not. It's just something that is very common. It's just like a cold. At least 1 in 4 women have come in contact with HPV at every point in their life, and this is not just a woman issue. It is a woman issue. It is a man issue, because men also have, the HPV virus. Okay.
Does it do anything to them?
Yes, it can. They can. Men do not have cervixes, so it can give them anal cancers, mouth cancers, penile cancers, and then it can have skin warts, genital warts. Okay, but it is not as serious as cervical cancer. I've seen women doing practice. I've seen women who, from the moment they're diagnosed, they just spiral down. So why can't we just reduce the numbers of deaths from, cervical cancer or from HPV infections just by having our women vaccinated, having our girls vaccinated, and then making sure that at the appropriate ages we're getting our pap smears done. At least if you get early screening, okay, you check for the cells and they're precancerous, you can remove them. There are simple in-clinic procedures where you can, get rid of all those precancerous cells, and then eventually it doesn't get to cervical cancer.
And for the men, what can they do, or what should they be doing? How can they be a part of this Bella Niger Stop HPV for Her campaign? Okay,
so very well, awareness first of all. They need to be aware that this is not just a woman issue, it's also a male issue. They also need to get, tested for HPV, right?
So men should get tested?
Yes, they can get tested for HPV, and then they can also get the vaccine, but it's not going to cost. Right now we're prioritizing, of course, we know cost restraints, poor funding, so we're concentrating on the girls between 9 to 14 because they have a higher chance. Okay, we are catching them young. They haven't gotten exposure to the HPV, to the human papillomavirus, so we're prioritizing them. However, the men can get the vaccine, the boys can get the vaccine, and they can create awareness about this. They can talk to the women and girls in their lives. They can join the Stop HPV for Her campaign by Bella Niger. We have He for Her. Okay, women should not be just the ones advocating for women's health, because men, we are a community. We have mothers. Men have mothers, sisters, lovers, friends, wards. So they should be actively involved in this. So through awareness, sharing this message, joining the Stop HPV for Her campaign by Bella Niger, and then also carrying those girls, carrying their women, making sure that they get vaccinated, making sure that they benefit from this free vaccination already going on. It's free. The best you can do is to just walk in and get it, and then you can figure out how to pay for yours later.
And why is this such an important topic to you as the health attainer? Why are you such a strong advocate for this, and how have you been able to use storytelling to raise awareness?
It's important to me because it makes my work easier, right? I started my brand out of frustration when I was training in medical school. I saw that huge gap between patient care, patient education, and treatment. A lot of patients come to the clinic, they are treated, but they do not have information, relatable information about what they have come for. For example, a patient comes in with ulcer symptoms, you treat, and then the patient still comes back the next 2 weeks or a week after with the same symptoms, because you have not had time to explain in relatable and easy language. Okay, this is the reason why you're first your own doctor before you get to the hospital. Okay, this is why you're having it. You have to do this and you have to do that. So that frustration made me want to do this, right? And then using my platform, making it easy, looking like one of you.
Beautiful, stunning.
Exactly, thank you. It just makes it easier to improve health literacy amongst Nigerians and even beyond, and then just break down the medical jargons, and the patient is able to understand 1 + 1 is equal to 2. If you don't do this, this will happen to you. If you do this, and then it just reduces the burden on curative medicine. Because when you have effective preventive, medicine strategies, then the doctors in the clinic have more time, to do their work. And of course, you drive more people into the clinic because now they are more aware of their bodies. They are more aware that this is the reason I'm feeling this way and I have to see a doctor. Okay, so storytelling helps. People love to people don't like that fear mongering, they're not afraid. They're now equipped with enough information. Information is power. Now I know, then I can walk comfortably into the hospital and say, this is how I feel, and I wouldn't feel, because sometimes patients judge themselves first of all before even getting to the hospital. But you know that, oh, this is normal from the way we've told the stories, from the way Bella Naija has started this. In fact, when I go to Bella Naija's page, I just keep seeing a lot of information about HPV, cervical cancer, and then it just becomes like a normal conversation. And then this is a normal conversation. You can just walk into any primary healthcare center and nobody's looking at you and say, oh, what is this person going into this place to do? It is health. Health is, should be accessible, and then it should be enjoyed by everyone.
Well, I want to say thank you for the good work you're doing. I'll be taking that line away, that you're first your own doctor, so the responsibility is on us to get information, and thank you for making that information accessible through storytelling. Thank you, Dr. Kelechi Okoro, and we wish you all the best with the Bella Naija Stop HPV for Her campaign.
Thank you very much for having me.
And please do get your girls tested between the ages of 9 and 14. It's free at all primary healthcare centers across Nigeria. And to follow the conversation, just check hashtag Stop HPV for Her by Bella Naija.
Now it's time to show